My name is Sharon Kha. First, I was an English teacher. Then, I was a television news reporter for 10 years. Then I was a spokesperson for a large research university. And then, I got Parkinson's disease. Even before I was diagnosed, my coworkers were saying things like, "Excuse me, could you repeat that? Could you speak up? Say what?" It's pretty hard to be a spokesperson for a university if nobody can hear what you're saying. And I knew exactly how devastating the loss of my voice could be. My father was a minister. I was used to hearing him preach every Sunday morning. When he got Parkinson's disease, his voice became almost inaudible, and it changed the way people treated him. Waitresses in restaurants grew irritated as they tried to understand what it was he wanted to order. My friends thought he was senile. Strangers treated him like he was a public drunk. He was isolated even though he was in crowds of people. And as far as my father knew, losing his voice was just one of the inevitable tragedies of Parkinson's disease. Actually, speech problems are one of the few symptoms of this incurable disease that can be fixed. The thing is, the 89% of the people with Parkinson's who develop speech problems often don't recognize it themselves. Now, you'd think after what I saw with my father that I could have recognized what was going on with me, but I just thought everybody around me had gone stone deaf. How could I have missed the fact that I wasn't speaking loudly enough? How could I have been so wrong? Well, an interesting thing happens. Your brain tells you that you're speaking loudly enough, or maybe even too loud, even when you're mumbling. So you have no way to gauge when you're speaking at an appropriate level. Doctors Lorraine Ramig and Cynthia Fox and the clinical research team at the National Center for Voice and Speech in Denver, Colorado, began working with people with Parkinson's disease more than 15 years ago to develop a therapy they called the Lee Silverman Voice Treatment, or LSVT. Mrs. Lee Silverman was a person with Parkinson's disease for whom the treatment is named. I'd like you to see firsthand the powerful effect LSVT has on a woman named Shirley.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Uh-huh. Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say "ah" for as long as you can.
Ah.
Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Until I get mad and then yell.
Take a deep breath and say "ah" for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh yes, I set some of our friends back when we went to their house and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
Shirley did voice therapy to improve the quality of her voice. But did you notice the way her face changed? And she had more inflection, her voice had more highs and lows, and in fact, it was clear to me that her self-concept had improved. When I did this therapy, it worked for me. Think Loud is a deceptively simple exercise-based program, but it's also based on years of scientific research.
I'm Cynthia Fox, one of the members of the LSVT clinical research team, and I worked with both Sharon and Shirley, the two women you met here. As dramatic as the changes in their lives were, they're just two examples of the thousands of people around the world who have participated in this program. LSVT is an intensive voice therapy program that consists of 16 individual 1-hour treatment sessions in 1 month's time. During treatment sessions, people with Parkinson's disease are taught to think loud, thereby improving both their vocal loudness and the pitch range of their voice. During treatment, there's a series of voice exercises followed by a speech hierarchy where people learn how to use their loud voice while speaking. In addition, there are daily homework exercises and daily carryover tasks to use this new loud voice with someone outside of the treatment room. An essential element to treatment success is teaching people with Parkinson's disease that the voice they think is within normal limits is actually too soft, and this new louder voice is normal. 15 years of research led by Dr. Ramig with over $5 million in funding from the National Institutes of Health have documented changes in people with Parkinson's disease following LSVT. These changes include improvements in voice, speech, facial expression, swallowing, and even neural functioning.
Improving your voice is one thing you can do something about if you have Parkinson's disease. And the interesting part is that when you work on your voice, you change the way people perceive you. And I stopped seeing myself as an invalid and saw myself instead as a part of the conversation. I'm convinced that if my father had had an opportunity to do this therapy, it would have changed his life. It is possible to have power over Parkinson's, and it's possible to think loud.